New infections of HIV could rise 6 times by 2029 if the Trump administration drops its financial support for measures to fight the disease. The United Nations AIDS Agency spearheads the global response to HIV, the human immunodeficiency virus, which attacks the body's immune system. If left untreated, HIV can lead to AIDS, acquired immunodeficiency syndrome.
In 2023, 1.3 million people around the world newly acquired HIV, 3 times higher than the global target set for 2025 of no more than 370,000.
The 2023 infection rate is a 60% decline from the virus's highest point in 1995. But Winnie Byanyima, executive director of UNAIDS, says there could be a dramatic rise in cases if the United States permanently cuts funding through the U.S. President's Emergency Plan for AIDS Relief, which was established in 2003 by President George W. Bush. According to the Department of State, since its inception, the President's Emergency Plan for AIDS Relief has invested over $100 billion in the global HIV/AIDS response, saving 25 million lives, preventing millions of HIV infections, and supporting several countries to achieve HIV epidemic control, all while significantly strengthening global health security. Trump's decision to freeze foreign aid for 90 days puts organizations like UNAIDS and the grassroots efforts they support at risk. Without American funds, officials estimate 8.7 million people could be newly infected with HIV. 6.3 million people could die from AIDS-related diseases globally, and 3.4 million children could be made orphans because of HIV/AIDS. The Trump administration decision has drawn praise and criticism from both sides of the political aisle. Maryland Congressman Jamie Raskin said,
"I'm hearing from my constituents who work for USAID and USAID contractors in Maryland, in Washington, all over the world, and they're telling us that this is a killer in terms of their cutoff of HIV and AIDS preemption. It's a killer in terms of anti-malarial education. It's a killer in terms of all of the efforts to shut down global viruses."
The chairman of the House Foreign Affairs Committee told CBS News Face the Nation,
"There was a release of that hold that was authorized, but it shouldn't be the case that the American people fund HIV and AIDS drugs for 20 million people across Africa, where many of these countries are working very directly with our adversaries like China. That is an example of them taking us for granted. We need to be asking the question, should they be weaning off of this? Should we be paying it for these very expensive HIV and AIDS drugs? Should the American worker be footing the bill for that? Those are real questions."
The pause in American funding is already having an effect on care. UNAIDS said in Ethiopia alone, tens of thousands of people, especially women, young girls, and high-risk groups, will lose access to critical services. 5,000 healthcare workers have already been terminated because their roles were funded by U.S. assistance. Suppressing diseases like HIV and AIDS is not just about being compassionate to other nations. In this globalized world, international healthcare means diseases are less likely to infect American citizens.
We say it's dangerous is because currently we are not on track globally to end AIDS by 2030, as was agreed by all the governments of the world. We are not on track. And the reason is inequality. But there's good news. By equalizing, which is possible, we can end AIDS.
The Trump administration has not given details on what will happen after this 90-day pause in foreign aid concludes. For Inside Edition Digital, I'm TC Newman.